Hello po, and a very good Thursday po sa inyong lahat. And today we are starting our celebration po of February, which is Love Month. And aside from it being the Love Month, it's also known as the Cardiac Month. So we will do po a number of cardiac topics po para maliwanagan tayo how to care for our heart and how to know po kung ano po ang ginagawa at in-order po ng doktor para sa ating puso. So I'm Dr. Ana York Bondoc. Our program po is called the Libreng Consulta kasi po we accept all questions regarding our cardiac topic, COVID and non-COVID. Ilagay nyo lang po sa baba. Please follow us on YouTube. We are trying to reach 1,000 subscribers. Our YouTube name is Dr. Ana York Bondoc. Okay? So, our topic today is the electrocardiogram. Kasi po, letter E na po tayo for the medical word of the day, and it's about the electrocardiogram. So, let's start. Ayan. So, our topic today, EKG, also known as ECG, and the long name po, or the formal name is called the electrocardiogram. Kaya lang po, as you go in the hospital, halos wala na hong maririnig na electrocardiogram. Most of the doctors, most of the cardiologists, they will order ECG. Pwede rin naman pong sabihin na EKG. Both of them are actually accepted. So, ano ba ito? Well, pangkaraniwan po, can we have the first slide? I have a number of slides po to show you para po maliwanagan po tayo. Okay? So, let's look at our first slide. Ito po yung ating title. This is the picture that I used. And if you notice po, there are a number of spikes and then there's a cute-looking heart in the center. I just wanted to let you know na ito po, hindi po ito yung tamang ECG or EKG. This is just an artist rendering. Wala pong heart sa EKG, okay? But the spikes po, those are actually correct. And I will explain po, ano po ba yung mga spikes na yan and why are they ordered. Okay, so let's start po. Itanggalin po natin si first slide, balik po tayo. So, what is the ECG? The ECG po is the most common and the most widely requested po test regarding our heart na ino-order po ng mga doktor, whether they are cardiologists or regular internists or family physician, para po ma-evaluate po ang status ng ating puso. So, it is really the first test. Kanan at kaliwa po talaga itong ino-order sa mga doktor. And sometimes you have to go to the lab to have it done. Sometimes it is done directly po in the doctor's office. And the doctor will say, you need to have po an ECG or you need to have an EKG. And then, ayun na po. So, ang dami po, no? Kanan at kaliwa ito sa Pilipinas and all around the world. And I really suspect that most of us do not know kung bakit po, and what's the point of the ECG. And I suspect that many of us have never asked our cardiologist or our doctor, Doc, ano po ba yung EKG? And I suspect, nobody ever asked me this also. At sa tagal ko po ng practice, nobody ever asked me. Pero I suspect, kung tatanungin ko po yung isa-isa sa inyo, you cannot tell me po kung ano po yung EKG. So, eto na po yung sagot, okay? The EKG is the most widely ordered cardiac test po, and it is usually po the beginning test of a number of tests that you may have to undergo. So ito po talaga si step 1, okay? And sometimes we do this po for many reasons, and pupuntahan po natin siya. Okay, what is it actually? First of all, bakit ho may mga spikes, may mga lines, ano po ba yon? Okay? So, I myself, and if you are not an internist, like mga surgeons po, marami po sa kanila, hindi na po yun ang specialization nila. But for the internist po, or the internal medicine or the cardiologist, talaga pong starting point namin ang isang EKG. So, what's it? It is the record po of the electrical activity of the heart, which is measured po by the various electrodes that are attached po to our body. Let's go through that. So, electrical activity po ng puso. Okay? And I will go later why the heart has an electrical activity. Magugulat po kayo. Okay? Next slide po. Okay, eto po ang tamang EKG. Hindi po yung may heart na cute, okay? Is there any way for us to make this larger, please? Kung pwede lang para makita po nila ng close-up, okay? This is the way an EKG really reads po, no? It is placed in a grid of paper. Tumatakbo po yan continuously. And then you see the, the technician, they tear it off, ano? So, yan po yan. The spikes that you are seeing, those po are the spikes that are produced by the electrodes po that are attached to your chest. And sa different interpretations po of these spikes and along the graph po will, it's over time eh. May timing ho yan. So it's over time. And that will give us many clues po about the functional status and the structural status po of your heart. So it can tell you po so many things. So isa-isahin po natin. Okay, next slide please. Ayan. Okay, why do we have the structure of the heart here? Okay? Pwede kong palakihan, yung dalawa pong dark na dalawa sa taas, ayan po, I cannot point to it eh. Kung may pointer po kayo, yung dalawang cavities po na dark, those are our right, ayan. Yan po ang ating right and left atrium. That is along the top of the heart. The two bottom chambers, ayan po, kung makita nyo po, that is the right and left ventricle. Okay? So, anong nangyari po dyan? We cut our heart in the center, no? Pinutol po natin. It's a crosswise. Ganito po pinutol yung ating heart. And the top po is the atrium. The bottom po is the ventricles. Okay? So, the atrium po, what is that? I really found it very difficult po to explain this to a lay person. Nahirapan po talaga ako. And I hope that you will bear with me. And if there are any questions, wag po kayo mahiya. Okay? So basically po, the heart, there is an electrical activity po in our heart that causes it to beat. And that causes it to, to dilate, to accommodate blood, and then to contract, to push out blood. So may sequence po yan. And that sequence is actually provided po through electricity. It's very hard to understand, pero may electricity po yung puso natin, okay? And the wave of depolarization po, or the way the electricity works in the heart po, it comes from the sinus node, which is, ito pong maputi na mataas, that is between po the atrium, and then it depolarizes po the atria, kasi dun po pumupunta muna yung dugo, and then pababa po to the ventricles, and then to the atrioventricular node, which is another electrical point of the heart, and then finally palabas. So the rhythm po, the way the heart works is from the atrium to the ventricles and then out. From the atrium to the ventricles and then out. Ganun po yon. And the electricity flows in that direction din po. Okay? So that electricity po is read by the electrodes that are placed over your chest. There are going to be 6, and the 3 limb leads. Kung napapansin, can I have the next picture po? May picture po ba nung mamang naka-EKG or somebody who's attached? Ayan. Opo. If you notice, no, do you see the blue? Ayan po, no? On the right side po, that is the EKG machine. May makina po. And I think most of us have had that. Ito pong makina, yan. Where the is pointing, yan po yung EKG machine. It reads po the energy coming from the electrodes, yung blue po na nasa chest po nung mama. Okay? So marami na ho sa tayong nagpa-EKG, magkakabit po sila ng 6 dito pababa, following the heart. It's on the left side of your heart, and then there is 2 electrodes, right and left, at isa po on your left foot. So basically, eto pong mga electrodes na ito, they will read the electricity as it comes out. I know it's hard, okay, but just believe me. Babasahin po nila yon, and then it comes out po into a series po of lines and graphs, and ito po yung graph po ng ating EKG. The EKG will read po through the electrodes, the electrical activity of the heart as it goes po from the atrium to the ventricles and then out. So, yun po yun. And that is why we attach this to our chest po and we attach it to our arm and our leg. Okay, next po. So, one question people often ask me, Doc, masakit po ba ang EKG? I think a lot of us have had EKGs and I would like to assure you it is not painful. Medyo sa mga nagpa-EKG, nobody ever told you, no, what it is, why. Basta kinakabit lang po nila. So basically, they are trying to read the electrical activity of your heart and it is translated po into the machine and the machine puts out a series of graphs po. It's actually electricity over time. Kaya po, merong graphing po or time yan po ng atin pong EKG. Okay? So what do we find out when we do the EKG? Balik po tayo sa atrial fibrillation. One of the things po that we find out po is the rhythm of our heart. Is the rhythm of our heart normal or abnormal? Okay? Yung normal po, balikan po natin si slide 2. That was the normal EKG. Okay? Normal po siya. There's most of the beats po is between, kaya may timing ho yan eh. It's between 80 to 90 or between 70 to 80 beats per minute po. That is the normal. And napapansin nyo po, each beat should be equal and differently from another. So, bawat point po, that's a beat. And then, bawat point po, yan po yung tibok ng ating puso. It should be normal. So, one of the things that the EKG will find out is, paano po o gaano po kabilis ang tibok ng ating puso? Question number 1, is it sinus rhythm? Ano po ba yung sinus rhythm? Between 60 to 85 and a little higher po. And then, pantay-pantay po yung pak-pak or labdab, 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 labdab. Yun po yun. Pag pantay po lahat yan, and it's coming out po in the EKG na pantay po, the difference between each line is the same, then that is what we call a normal rhythm or a sinus rhythm. Okay? So, puntahan po natin yung atrial fibrillation again. Let's talk about a few common rhythm disturbances or bakit po naiiba po ang tibok ng ating puso. At nalalaman po natin ito by reading one's EKG. Meron ho ba sa inyo na nahatulan or do you ever have parents or anyone or nahatulan po na atrial fibrillation? What is atrial fibrillation? Ito po yung abnormal beating po ng ating puso. Sometimes it is fast. It goes tagdag, tagdag, then tagdag, 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 tagdag. Parang ganun ho, or tagdag, 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 and then tagdag. So, abnormal beating po talaga ng ating puso, very common. It is atrial fibrillation. Ang meaning po nun is our rhythm is again not normal. Pwede ho nating makapa dito po sa ating pulso and here over our chest, and it is verified po using an EKG. This is one of the rhythm disturbances po, very common, that can occur po and are picked up by the EKG. So kung pupunta po kayo kay Doc at sasabihin nyo, Doc, parang mabilis po at irregular po ang tibok ng aking puso, the first thing that they will require po is an EKG at malalaman po natin yung ating pong heart rhythm. And one of the most common po is atrial fibrillation. Okay? Next po. Ayan. What is this naman po? Ito po ang tinatawag po nating bradycardia. You can be po bradycardic, which is slower than 60. Actually, malapit na hong masama na ho ito. Baka, this is actually agonal rhythm near death. In other words, it's so slow. When someone is near death po, their heart rate will slow down and become super bradycardic until finally it becomes agonal rhythm and then finally po, nagpa-flat line. And that is when we pronounce someone dead. Okay? So, bradycardic below 60. Pag below 40 po, below 30, hindi na po talaga maganda yan and usually leading po to death. So, we can see that pag may nakakabit po na EKG sa dibdib po ng ating pasyente. Okay, next. Ayan naman po, what is this? It does not look normal. Ano po? Nakikita nyo po, ibang-iba. Well, this is usually po what we call ventricular tachycardia vita. It's actually ventricular fibrillation leading to ventricular tachycardia. Ito po is usually the rhythm that we see during a heart attack. Nagkakaproblema na po, and this is the rhythm that we normally shock. If you watch po sa mga mahilig kayo sa mga medical ano po, or you like to watch mga documentaries, when we see a VFib leading to VTAC, pag mag-continue po ito, the patient will not be risk kasi the heart is beating in a regular fashion po talaga. Walang lalabas pong dugo dito. This is uncoordinated beating po ng puso leading to the patient will code, wala pong dugo, the patient will code, at pag hindi po natin ito nabalik to normal rhythm or what we call sinus rhythm, which I showed you in the beginning, malamang po magko-code at mamamatay po ang inyong pasyente. So this is another rhythm po that we could see po on our EKG. And if you notice po, no, sa mga medical, ano po, pag nagsi-CPR po sila, ang una po namin talagang kinakabit are the electrodes so that we can see what we are doing. Okay? Next po. Ayan. Okay? So let's talk about, balik po muna tayo, no slides muna. So yun po, I described to you one of the most common reasons po that we have EKGs for, and that is kumusta po ang pagtibok ng inyong puso, or what is our heart rhythm. And it's very important kasi po rhythm, lack of rhythm, sinus rhythm, which is normal rhythm, bradycardia, yung very slow rhythm, tachycardia, yung nagmamadali, disorganized beating po, leading to death, that is VFib leading to VTAC. Those are things po that we need to know kasi po, bawat disorder po na nakikita natin, may kaukulang gamot po at may kaukulan pong dapat gawin ang isang doktor to restore your rhythm to sinus. Okay? Another thing that we use the EKG for example po, sakit ng dibdib nyo. Pumunta po kayo sa ER, hindi po kayo makahinga. You feel like there is an elephant on your chest. And we all know that those are the cardinal signs po of a heart attack. The first thing that the doctor will do upon reaching the ER, siguro po kukunin yung BP nyo, no? But the next thing that they will do, kakabitan na ho kayo kaagad ng electrodes to see po yung inyong rhythm, and then later on to take a full EKG po, and malalaman po natin dito, are you having cardiac ischemia or are you having a heart attack? So basically, acute ischemic event po, or what they call now a myocardial infarction, or AMI, acute myocardial infarction. So ito po, that can be seen, the EKG will be the first po, but not the only. Marami pa po, including blood tests and cardiac echo, but the EKG will really be the first and the fastest way that we can find out whether someone is having an active cardiac event or even a heart attack. Okay? Another reason po that we do also EKG is to find out po electrolyte disturbances. Ano po ba ang electrolytes? Ito po yung mga sodium, potassium, yun po yung and chloride, the vital electrolytes po na kailangan po ng ating katawan. And may kaukulang changes po ang hyperkalemia, hypokalemia, and they can be quickly found po on the EKG. However, it's not the only way po. The most accurate way po, syempre, is to take blood and to measure our calcium, sodium, and chloride. Okay? Another thing po that the EKG can give us a clue is the structure po ng ating heart. There are clues leading to left ventricular hypertrophy. Makapal na po yung left side ng ating heart. May clues din po on right ventricular hypertrophy on the right side of our heart. Pero again, beginning lang po ito. We are not going to make the diagnosis po of structural abnormalities of our heart based on the EKG alone. But kung abnormal po, that will push us to do an echo. And puntahan po natin yung echo next, okay? Another reason to do EKG po is what we call stress testing. Meron po tayong stress testing based on EKG. Ano pong meaning nun? Okay, what is the meaning of stress testing with the EKG or stress test EKG? Ito po, your heart could be normal. So gagawa po silang baseline EKG. Normal po si heart. Okay? normal beating, normal rate, no, ang ganda po ng mga curves nyo at hindi na natin pupuntahan kasi that's very complicated. Pero after that, once they do the baseline EKG po, they will keep asking you to walk on a treadmill. Pabilis ng pabilis, pahirap ng pahirap, pabilis ng pabilis, parang they're putting a stress on your heart. And titingnan po nila yung EKG nyo. Kung sobrang bibilis po ba, babagal po ba, and may lalabas po bang signs na nahihirapan na po yung puso nyo, or signs of cardiac stress and ischemia. And that is what we call a EKG stress test. So, yun po yun. Another thing po na mahilig ako, I'm an ICU doctor. Everyone po who is admitted to the ICU, or actually to the ER man lamang, naka-electrodes po yan and kumakabit po sa taas. Sometimes there's a machine there. Ayun po, we can see somebody's rhythm minute to minute po. Malalaman po natin kung bumibilis, kung wala nang rhythm, baka patay na po yung pasyente. And then also, malalaman din po natin the changes po rin, is your EKG normalizing, is your EKG getting worse. So yun po yun, there is a minute-to-minute monitoring po sa loob po ng ating ICU. Another reason po for EKG also is what we call po in the OR. Yung habang kayo po ay natutulog under anesthesia, the anesthesiologist po would like to know po rin po the status of your heart. Bumibilis ho ba? Bumabagal ho ba? And that's why we do peri-operative or intraoperative monitoring po of our cardiac status. Okay? And then, di ba binanggit ko po, but we also use the EKG to pronounce somebody dead. Okay, I'm sorry talagang, I don't want to be morbid. Pero pag kinabit po natin yung electrodes, wala po tayong nakita, flatline po siya talaga, well, then that person is declared dead. Okay? And in an emergency setting po, may nag-collapse, we use the EKG rin po to determine kung ano pong gagawin. So can we see the next slide po? Ayan, what is that po, no? Ano po yan na nakikita po natin? That is our defibrillator. We usually use that po in the ICU, in emergency settings po. And two things po ang nangyayari po dyan, no? We could see po the rhythm. Lalabas po dyan yung ating rhythm. Okay? Our rhythm will come out. And based on the rhythm po, malalaman po natin kung ano po dapat gawin. We can find out po based on this. Ano po? Okay, next slide. Sorry, ayan po. Those are the paddles. Ano po? Ano po yung paddles na yan? Diyan po tayo nagbibigay ng electricity. Basically, we're shocking a person po talaga during this time. Okay? Why would we do that? O, sige, next. Sa mga mahilig pong manood ng ER. Ayan. Okay, lalagay po yan. O, nakikita nyo po yung puti in between the two paddles. That is the electrode po of the EKG. The red and the yellow. Ayan. So, ayan. Red po at saka yellow. That will tell us po the rhythm. Well, the rhythm probably of this patient po is VTAC. Yung nakita po nating magulo kanina. And we need to shock. Why do we shock? We shock the heart po 200, 300, 360 po. Para po bumalik po, para tumigil po yung puso in the abnormal rhythm and sana po babalik po siya to sinus rhythm. Okay? So it's quite an emergency situation po. Once somebody collapses, let's say they had a heart attack, pagkabit po natin ng ECG, nakita po natin VTAC, the first thing that we will do is to give oxygen, medications, and shock the patient po. Okay? So next slide, please. Is that it? No more
Yes
slides?
po. No more slides na
Okay.
po.
So yun lang po. So in summary po, the EKG is the most common cardiac diagnostic test po na in-order ng mga doktor. It can tell us many things po about the heart. But again, once we find something on an EKG, if it's an emergency situation po, we need to act. Sometimes we may even need to do CPR or may give certain drugs. And sometimes po in a non-emergency situation, it can guide us po towards different diagnoses and can lead po to other more definitive diagnostic exams. So yun lang po. So the next time the doctor orders the EKG, alam nyo na po kung bakit. Hindi na po kayo, baka naman mas lalo kayong kabahan ngayon na alam nyo, no? But malaman niyo po ito so that you know that it's not painless. It can give you po much information about your heart and so that you know po why you are undergoing that exam. So sa inyo po lahat, magandang hapon po and I'm willing to answer any questions. Okay?
From Mr. Carl Larry Bautista. Hi po, Doktora.
Hi, sir. Question, has any one of you undergone an EKG before? Ikaw, Reina, have you had an EKG or have you helped the tech do an EKG?
For both of your question, yes and yes. Yes, kasi na twice CS ako, di ba, Doc? So
Ay, oo, yes.
you have to monitor my heart.
Yes, tama.
Yes, and then yung second is, yun nga, yung nagkakabit kami talaga ng mga ECG, yung mga a little, I forgot what is it called. It's been a decade.
Oo.
So, yun,
Pero
yes,
talagang yan, naka-experience ka na at tumulong ka na rin gumawa
yes,
ng
yes.
EKG. That's good.
Ito ang
Okay.
isa sa mga, just to share, Doktora, my experience in the clinical setting. EKG is one of the kumbaga sa pinaka-climax ng isang pelikula. Hindi ba, Doktora? Kasi yan yung
Yeah,
magsasabi sa'yo kung ano nang nangyayari sa pasyente mo.
definitely you need, yes. It's actually it's the beginning of a long series of tests, lalo na po kung ICU patient ka or ER patient ka. So talagang it can be the climax, like halimbawa, somebody collapsed, tapos ilalagay nyo yung electrodes dyan para malaman nyo kung talagang anong nangyayari sa puso niya. Or it's possible actually na just the beginning pa lang yun, alam mo, sumasakit ang puso mo, you don't feel well, it could be the beginning of a long series of tests po. No? So, two things. Sama si Ma'am Reyna. Halimbawa, nag-collapse do sa ER, talagang hindi nyo na alam kung gagawin nyo, kabitan nyo ng ECG, malaman nyo po kung talagang ano na po yung tibok po ng puso niya, if you need to shock this person or not. Okay? So yan, tama yon. Or if you're not feeling well lang, then you went to the doctor, then marami pa palang kailangan gawin aside from the EKG, pwedeng beginning pa rin lang siya. So it can be both the beginning and the end. Yon. It can also be the end, literal end, kasi we use the EKG also to pronounce persons dead. Okay?
Yes, dun talaga, kaya sinasabi ko kanina, it's the climax.
Yes, pwede. Yes, pwede. Kung talagang flatline na po talaga yung tao, there is nothing you can do anymore. Lalo na kung matagal na po. Okay?
From Miss Nena Pangan, hello, Doktora. Pag di po ba nagpo-flow ng maayos ang blood sa veins, affected po ba ang pag-pump ng heart?
Yes, ma'am. Usually, yes. Because the heart po, let me just put it this way, okay? The way I interpret your question, I hope it's okay. If you mean na hindi po maayos ang pag-flow ng blood sa veins, the way I interpret that, ma'am, baka barado po, no? Like maybe maraming cholesterol, ganun po yon. So that can really be transmitted po to the heart because there are coronary arteries po. Pag nabara po yon, especially po the left, kasi po yun ang nag-aano ng left ventricle, then we will have po what we call a heart attack. Or we will have poor blood flow of the heart leading to ischemia and what we call po a myocardial infarction. Okay? Or an acute cardiac event. Some people put it that way. So tama po yun. Yes, that is possible.
From Miss Barbie Taruk Olap, Doktora, ask ko lang po ba, kakatapos ko lang po ng ECG nung isang araw kasi po nanlalambot ako at madaling mapagod. Nagpa-blood chem naman po ako at ECG ay normal naman po lahat ang result. Pati po yung tenga ko, tina-ENT ko kasi po lagi akong nahihilo. Ay okay na po, natuyo na daw po ito. May kinalaman po ba sa vertigo ang panlalambot ko? Ano pong magandang
Yes.
vitamins para dito, doktora? Marami pong
So, are
salamat.
you having, opo, ma'am question, mahaba po yung tanong eh. Are you having vertigo? Nakalagay ba dyan,
Yes,
Miss Reina?
opo.
Is she having vertigo?
Opo. Yes po.
Yes,
May
ma'am.
kinalaman.
Okay, the way I got it, your lab test, your blood tests are normal, and your EKG is normal. Tama din po ba ako?
Yes, doc. Yes.
Okay. Okay. So, ma'am, yes, if your problem po is vertigo, nakakapanghina po yun. It's very disorienting po na talaga pong parang umiikot po yung kwarto. It's really not a good feeling. Nakakapanghina po talaga yon. Imagine you just try to get up po from the bed, talagang nahihilo na po kayo. Nakakatakot actually. But I am happy to hear that your EKG and your blood test po are normal. And from what I got, medyo na okay na rin po yung vertigo. So yes, ma'am, that could be a reason po kung bakit po kayo nanlalambot. Okay? And I hope you get better. Mahirap po yan. That's not an easy, ano po. Okay?
Yes, from Miss Nick Feder. I had ECG last week and was confined in a hospital for close monitoring. Hindi naman po ako nag-collapse pero felt so tired for a few days kahit walang ginagawa. Yesterday, nag-2D echo na po ako pero no result yet. Ganun po ba talaga walang ibibigay pampakalma ng palpitations po?
Ma'am, are you having palpitations? Okay. Let's go there muna. The EKG and palpitations. Okay. Sometimes po, yung mga taong nagpapalpitasyon, this could be due to atrial fibrillation po. One of the most common, which I placed doon. And may gamot naman po yon, okay? Some of the problems po with palpitation is when you go po to the doctor's clinic, mag-order po sila ng EKG, no? Sasabihin mo, Doc, napapalpitasyon po ako. Would you mind to take down the question lang po para I could see the screen? You tell the doctor, Doc, napapalpitasyon po ako. Okay, so the doctor will say, Ma'am, or whatever, no, Sir, pa-EKG. It just during the EKG, wala kayong palpitasyon nararamdaman. So, normal po siya, no? So we do what we call a Holter monitoring, Holter. Paki-ano lang, Holter, Holter. What is a Holter? A Holter po is like a mini EKG po that you wear around your neck or parang gano'n, nakakabit po sa inyo for 24 hours. Tama po yan, Holter. Yan. 24 hours po yon, sometimes even 48, but mostly 24, no? Para po, yung tinatawag po ninyong palpitasyon, makita po ng doktor. Kasi sometimes, when they do the EKG, kasi parang on the spot lang po yan eh. Hindi ho yun yung time na tumatakbo po yung puso nyo. So, we do what we call a Holter monitoring so that people will wear it for 24 hours and mahuhuli po nun yung whatever po na palpitasyon for the next 24 hours. So, balikan po natin yung tanong ni ma'am. Yes, as I mentioned before, the EKG can give clues po sa atin na maybe we should probe further and do an echocardiogram or echocardiography. Puntahan po natin yan at another time kasi another long discussion po si echo. Okay? Reasons po for palpitations, I often, people ask me, napapalpitasyon po ako, what should I do? First of all, number one po, no, I try to do an EKG. And then the next thing that you should investigate po is, what's the status po of the person, okay? Number one question, how much coffee do you drink? Number one question talaga yan, Miss Reina. I'm sorry, magugulat ka. There are people who drink up to 6, 7, 8 cups of coffee a day. And talagang mapapalpitasyon ka because caffeine. Yan.
I'm in on that. 6 to 7 cups. Pero I reduce it to 2 na lang.
Oh, Diyos ko, Reina, don't do that. My gosh, no, okay? Because the caffeine substance po is not can produce po tachycardia. What is tachycardia? Mabilis po, fast heartbeat, okay? So, coffee investigation. Second investigation po is ano po, energy drinks. Naku, so bad po talaga yan. There are sometimes people don't even know what they are drinking. They're just buying this from mga health food stores, naka-label po na mga energy drinks. Hindi po natin alam the amount of caffeine po that is there. Sometimes it's pure caffeine. So be careful po sa energy drinks. Nagpapalpitasyon po yung mga tao talaga kahit mga bata. Kahit mga bata po, they can go wrong with the energy drinks. Number 3 po, no, and this might surprise you, drinking too much tea or too much soft drinks, okay? That's why they're actually making non-caffeine Coke na ngayon kasi ang tindi rin po ng caffeine sa Coke. And you might be surprised po, ang tindi po ng caffeine in tea, tsaa. Okay? So, I would investigate those issues po when somebody tells me napapalpitasyon po ako. And then, thirdly, of course, I would put them on a Holter monitor as I mentioned. Another thing that's very interesting po, yung panghihina. Though people don't mention this, they have what we call po syncope. What's syncope? Okay? Syncope po is fainting. Fainting, nahihimatay. And I don't mean po yung nahimatay dahil kulang yung kinain, okay? Which is usually, or nahimatay dahil maarte. No, ha? Syncope po, or is a more serious form po of fainting. People have actually been found, ano po parang nagigising po sila, they don't know what happened. And this is very scary because usually it means a cardiac event occurred. Parang nag-weird beating po yung kanilang puso. Kung nagtuloy-tuloy po yun, they would have died So, naiba po yung beating ng puso nila, the blood did not reach their brain and they fainted. Or bumaba masyado yung presyon nila and they lost consciousness. So that is what we call syncope. And Holter monitoring and rhythm monitoring po is necessary for this issue. Okay? So, ma'am, I hope you get better. I hope your echo results are okay. Okay, good luck po.
From one of our viewer, nakita po ba ang heart attack sa ECG?
Ay, maganda po ito. When you enter the ER po, no, and you say, I feel like I'm having a heart attack or I cannot breathe, pain po on the left arm radiating to the jaw, the first thing that they will do po is EKG talaga. Second that they will do is blood test Pero EKG po talaga ang una. And yes, they can see po the signs of an acute ischemic event or a cardiac event po. Tataas po ang certain aspects po ng inyong EKG and they can find that out. And once they do that po, that will trigger po yung ating heart attack protocol. Okay? Please share with us po yung mga EKG stories nyo if you have any, or if you want to ask a question, or even if you just want to share po yung mga EKG experiences nyo, ilagay nyo lang po sa baba. Okay?
From another viewer, masakit po ba ang ECG?
Okay. Guys, relax lang po. It is not painful. Okay? Ikakabit po yung mga electrodes. There is going to be a gel to help the electrodes po stick to your chest. There will be a gel on your arms and legs. Sometimes they tighten it with elastics. Pero hindi naman po talaga masakit. Okay? It takes minutes.
From another viewer, ginagamit ang ECG sa ICU po ba? Bakit?
Ayan. I don't know if any of us listening are ICU nurses, but definitely po in the ICU, talaga ang tawag po dyan is actually cardiac monitoring. Lumalabas po the number of it's a machine usually placed here. A number of things are recorded there. Yung inyong heart rhythm, heart rate. Usually yung the amount of oxygen in our blood po comes out there. So importante po talaga ang cardiac monitoring or a form of ECG po in the ICU. So yes, in the ICU po, minuto po kayo na i-ECG doon.
From Miss Corazon Espejo, bakit po kaya, Doktora, minsan po ang lakas ng kalabog ng nitong puso ko? Salamat po.
Ma'am, when people say that, I usually ask them, Ma'am, ano po ba, napapansin niyo po ba yung pintig ng puso niyo? And then if they say, yes, ma'am, parang napapansin ko po. My next question and what I teach them po is to take their pulse. Okay? To take their pulse. San po dito, oh? Ayan, na put your two fingers there, you can feel it. Ngayon po, one of the things that you should note po is pantay ho ba ang ating pulso? Okay? Bag, 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 bag. Ganon. If you notice po, let's say, malakas ang pintig ng puso nyo at that moment, feel your pulse. Kung hindi, if it's pantay, that's medyo okay kahit mabilis. Pero pag irregular po yung pulso nyo, like papak, 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 then pak, 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 papak, papak, then you need to have a check-up po sa doktor. But again, don't worry. Most of that is just sometimes, as I mentioned, too much coffee.
From Mr. Jason Alegria Silaran, Doc, yung heart rate po na mababa minsan 55 to 58 beats per minute. Pero normal naman ECG. Enough na po ba ang ECG or need po ng treadmill stress test? Salamat po. Sabi kasi ang normal heart rate 60 to 90 beats per minute. Nagugulahan lang po ako. Salamat po, Doktora. Hindi naman po ako athlete.
Okay, I was just gonna say that. Inunahan niyo na po ako, Jason. Okay, yes, it is true that anything below 60 is what we consider po usually to be bradycardic or slow heart rate. Pero yung binanggit niyo naman po, which is 55 to 58, that's not so far from 60. Okay? And ang masasabi ko lang po, yes, tama. You might be asking, no, athletes, why did Sir mention that? Ang athletes po talaga, because of the aerobic training po of their heart, and because of the amount of exercise that they do po, they tend to have lower heart rates, okay? And this is a sign po of their fitness conditioning, okay? Ngayon po, if you, like, di ba na, ano natin si Sir Paeng, usually po, mga champion, world champions, some of them actually have naturally slow heart rates. So that gives them po the greater aerobic capacity. Okay? But if you're not an athlete, the next question that I might want to ask to you is, ano pong gamot po ang inyong iniinom? There are some medications po that could cause a slower heart rate. Yun po yung tinatawag po nating beta blockers. So, some of the drugs po that we take to lower our blood pressure po could give us a slightly lower heart rate. And actually, doctors use this po to determine also the dosaging that they do. Kasi kung mataas na po yung inyong beta blockers at bumababa na po yung heart rate nyo talaga, then it's a sign that you have reached the maximum amount of beta blockers possible. And it's time po to add another kind of medication. At hindi na po pwedeng iangat pa po yung amount of beta blockers po na inyo pong iniinom. Another reason po rin also, there are also medications po that can increase our heart rate aside po from caffeine. One of these po is Ventolin, which is one of the most common drugs po talaga for asthma, and it can increase po our heart rate. So that's another reason for us to decide po if we're taking too much Ventolin po or not. Okay? So kayo po, if it's just not so far naman po from 60 and the doctor said everything is okay, wala naman pong problema yon. Ngayon, kung talaga kung nahihilo na po kayo and it's getting to be quite slow, then you need to report po of the doctor for another evaluation po. And baka po, there are also problems po with the way our sinus node, yung ating pong that provides the rhythm. Kung minsan po, it's not working that well and meron pong nagagawa doon. But kung between 55 to 60 and you feel okay, I think that's okay and pa-check up na lang po if anything else happens. Okay? If you are bradycardic, like masyado po talagang mababa, they may want to put in po yung tinatawag po dating pacemaker to pick up the pace po ng inyong puso. Okay? But for majority, please don't worry about that. Sa majority po ng mga cases, it's not that serious. Okay?
From Miss Nick Fefeder, and my palpitations po ay mga ilang buwan na before last week. Siya po yung nagtanong kanina na
Ma'am, kayo po siguro, if I were your cardiologist, I would put you on it's good that you have been in the hospital para they can see your kasi Holter is pauwiin ka eh. That's only 24 hours. If you stay in the hospital for 3 days, 4 days, talaga makikita po nila. And we have sometimes what we call cardiac monitoring units po in the hospital, which is people not serious enough to be in the CCU, but need to be monitored po for their heart rate. And that's good.
From Miss Barbie Taruk Olap, ay opo doktora, na-try ko na pong uminom ng energy drink like extra jaws. Bigla na lang pong nagpalpitate po ako sabay na
Ay,
hilo.
yes, ma'am, nakakatakot. So guys, please monitor your energy drinks. Some people, kahit kalahati pa lang, talagang it will affect them. So please, yun lang.
From Miss Patricia Uhano, doktora, ano kaya ibig ipahiwatig ng puso ko na pag may problema o naiyak ako ay sumasakit o mahapdi ang puso ko? Madaming mga ganyan. Diba?
Meron ho bang nagbibigay ng lungkot sa buhay nyo? Avoid that person or that situation. Ma'am, I guess people really, when we feel strong emotions po talaga, sometimes literal pong you feel that your heart is breaking eh. It can really happen, ma'am. I do believe that. But again, tao lang naman po tayo. We do, I mean, we can get emotional, especially po pag talagang malungkot po yung nangyari or maybe very scary. Literal po talaga pwedeng sumakit po ang puso ng isang tao. I do believe that.
From Miss Kathy Bungay. Okay. Doktora, maintenance ko po ang Angimax at Nebulet. Am I correct of pronouncing this? Sorry, Doktora.
It's okay.
Kasi po tumataas ang BP ko at every time nagpapa-ECG ako, sometimes normal, sometimes mabilis yung tibok ng puso ang result. Palagi din po akong nahihilo kaya umiinom din po ako ng Sinarizine. Okay lang po ba yung mga gamot ko?
Ma'am, it's not for me to tell you po na okay yung gamot nyo because I cannot, hindi po ako makapagbigay ng hatol based on a question. Kasi history and PE ho yan, including But what I can tell you po is this, it is true. Kung meron po tayong tinatawag po na white coat hypertension, meron po talagang mga taong nininervous po ng papa-EKG, bumibilis po tuloy yung tibok ng puso nila. So, I would suggest po, you calm yourself before you have an EKG, know the procedure, be reassured that it's not painful, and then that would help you po to take the EKG situation. Kasi po kung talaga nininervous kayo, parang nagagano na ho kayo, talagang mabilis po talaga ang lalabas po na tibok ng puso nyo. So this is one of the reasons why I explained common procedures. Kasi po, I don't think that anybody ever had a webinar on an ECG before. Ikaw ba, Reyna? Did you ever have? Ito mga nurses, yes. Sa mga EKG techs, oo. Sa mga doktor, cardiologists, med students, oo. Pero sa general public, the doctor just tells you, hoy, pumunta ka dun sa ECG. Opo, doc, yes. Okay po. Hanggang dun lang eh.
Yes, tama ka, Doc.
Wala talaga. Ikaw ba, Reyna, before your 2 ORs, did anyone tell you, okay, Miss Reyna, you're a nurse, ito po yung gagawin natin, this is why we need the EKG. Wala eh. The doctor just like, Mrs., kailangan nyo na po ng ECG. Go na. O, diba?
Actually, Doc, here's my experience well, you know naman, my partner, na sobrang nagkaroon siya ng high blood pressure and hypertension. Ako yung tinatanungan niya. Kasi mag-order si Doc, oh, kailangan mo ganito, ganyan-ganyan. Hindi niya naiintindihan bakit kailangan. Ano to, bakit ganyan. Tapos yung mga test, how are they related to each other? So I have to explain it to him in a way, kasi tama ka si Doc, nagmamadali, pandemic pa.
Oo.
Ayaw makipag-usap ng matagal sa mga tao. Alam mo yung 15, di ba, you were telling everybody na 15 minutes talking to a person can get you the virus, di ba, on that 15 minutes time. Ay nako, mga doktor ngayon, kahit naka-face shield, naka-face mask, wala pang 15 minutes, sulat, pak, okay, alis na. Pag may tanong ka, i-google mo lang. No joke lang po.
Ah,
Huwag po kayong
no, no, seriously. Ito lang, I am guilty of this, Reina. I have been practicing for a very long time. I have had thousands of patients. Parang I never bothered to tell anyone about the ECG. I'm sorry talaga.
It's a common, doktora, notion kasi na, um,
Stop asking questions and go
yes,
now. Okay, I need the
yes,
result. Ganon.
oo.
Sorry talaga.
Now, yes, yes. Ngayon kukunot yung noo nung magte-test sa'yo. Bakit ganito? Ganyan, ganyan. Siyempre, hindi
I
naman
mean, meron,
sasabihin.
oo, eto na, ik- yung mga EKG text ba nag-explain kung bakit nila
No,
kinakabit yung
bawal.
electrodes? Hindi rin
Bawal.
eh. Kasi
Bawal po.
nagmamadali din sila eh.
Bawal, Dok.
Bawal pa, oh my
Yes,
gosh.
bawal po
Bakit
mag-explain.
naman?
Even sa ultrasound, nung nagpapa-ultrasound ako when I got pregnant, even if you ask the med techs, they will not tell you. Even pagka sa blood extraction, it's bawal kasi they are to, actually, they know the result, but they cannot divulge the result. And it's only your doctor who can, it's something to do with the patient's confidentiality.
I am
Yun.
not asking the result. I am asking why you are doing this test. I think
Parang
suspect a
bawal.
lot of people don't even know also.
Yes,
I'm
bawal.
sorry. Gawa lang ng gawa ng exam, hindi naman nila alam kung bakit.
Actually, bawal din yung doc kasi parang si doctor mo lang ang pwedeng magsabi sa'yo na or mag-explain sa'yo why are you doing that. Actually, nabara nga ako one time kasi tinatanong ko, bakit kailangan magpa-ECG ganyan. So, sabi sa akin, ma'am, hindi niyo po ba natanong sa doktor niyo? Kung gusto niyo po, itanong niyo na lang po. Ganon ang sagot nila. Which is most practically, baka kaya din hindi nagtatanong ang ating mga netizen is that because expected na nila yung sagot na tanong.
Actually, kung minsan naman, people don't ask kasi nahihiya sila that the doctor might tell you, you don't know, you're such a dummy. O, diba? Wag naman ganun. Siyempre, not all of us are trained as doctors and nurses. And eto lang yung sikreto ha, guys. Please don't tell other people that I told you. But there are a lot of doctors who do not know how to read ECGs. And not because they're dumb, okay? But because that is not their specialty. Okay? I'm not calling anyone dumb, okay? Kasi usually sa med school yon or sa internship. And then once you become like an OB-GYN, then maybe a derma, and then maybe an ortho, hindi mo na hinahawakan yon. So, as a consequence, not all doctors. So guys, have mercy then on the patients who want to know why. And sometimes, I hate to tell you this, nagtataray ang mga tao because they don't know the answer.
Oh no, that's okay, noted, doctora, noted.
Yun talaga.
Noted. All right, from Miss Barbie Taruk Olap. Isang tanong pa po, doktora. Pag ba nagme-maintain ka ng losartan, okay lang po bang inumin ito kahit di mataas ang BP? Wala po bang side effect ito? Doktora, maganda
Ma'am,
yung tanong.
yes, this is actually a very nice question, okay? Doktora, 99% of people, Doktora, why do I still need to drink this medicine? My BP is normal. Okay, my question is, if you stop drinking the medicine, do you think that your BP will remain to be normal? Siyempre, babalik ko yun to the to the kung there was a reason why you were given that, it's because your BP was like 160. Sabihin na natin, okay? So you take the gamot, tinaas po yung then you ended up to be 120 after 3 months of taking the gamot na medyo mataas na. Okay? So you cannot stop that po because you will go back to 160. Okay? Pero, eto lang naman this is very interesting also. If, for example, you were 160 BP and 160 pounds and you are only 5 feet tall, okay? So, nag-umpisa ka ng gamot, but in the process, you lost 60 pounds. Okay? So, then you can try to see po kung ma-win off kayo. What is the meaning of win off? Unti-unti pong babaan yung gamot nyo to see if that you can maintain your BP. Nakuha mo yun, guys? Miss Reina, if may nagbago po sa buhay nyo, let's say you lost 60 pounds, then it's that time, tingnan nyo po, maybe, with the help of your doctor, do not do this by yourself, pwede naman hong babaan po yung inyong gamot. But kung wala naman hong nagbago sa buhay nyo, and you are now maintained on a good regimen, what I mean is good regimen, well-controlled, side effects na kakayanan nyo po, pagtigilan nyo po yung gamot nyo, pabalik po kayo sa high blood. Ayun po. And I would like to stress this also, no? Unless there was a reason for your being high blood, for example, you were pregnant, for example, you were overweight, ganun po, or you had a bad diet, majority po talaga ng hypertension is essential and it will remain with you for the rest of your life. I hate to say this, but it is true.
Promise.
Like, hindi lang po mysteriously mawawala yung BP sa buhay nyo. So, eto lang if you really had to take that medicine for a reason, magtanong ho muna kayo if you think na baka naman masyado nang mababa yung BP nyo, you might consider with the assistance of your doctor to reduce the amount of drugs that you're taking and to see po if your BP will remain normal. Okay?
Alright, from Mr. Orly Estela Dung Kamusni. Doktora, good PM po. Doktora, pag po ba parang naninigas ang sikmura mo tapos ang bigat ng dibdib, ano po ba yun? Parang hirap paghinga. Number 2, nagtitake po ako losartan tablet. Pag po nararamdaman ko lang yun.
First of all, based on that, yung masakit ang sikmura, naninikip ang dibdib, if you feel po na it's really getting to be a problem and getting worse, you need to be assessed po for your cardiac risk. What is your age? Lalaki po ba kayo? Do you smoke? Are you high blood? What is your cholesterol level po? And level of exercise and healthy lifestyle. So kung talaga pong, I cannot tell you po kung ano yun eh. Pero what I can tell you po is if it's getting worse, and talaga may chest pain po kayo, you need to be assessed for a cardiac risk. That will include an EKG. Okay. With regards to the losartan po, high blood pressure po should be taken regularly. 99.9% of the time, you should take it po regularly. Hindi po yung pabugso-bugso. So kung talaga binigyan po kayo ng gamot, whether it would be losartan or something else po, if it is for high blood pressure, kailangan nyo pong kunin or inumin po on a regular basis. Unless nag-shoot up lang po yung BP nyo ng 160 on that day, then pinababa po, yung pala nagalit lang po kayo or namatayan or something. And then, after that, it's 120 na po forever and ever, amen. Then there is no need to take the high blood medication. Pero yung pabugso-bugso pong pag-inom po ng gamot is not good. Especially if it was meant for high blood pressure po talaga. That is continuing. Okay? So, I cannot tell you po kung ano po yung sakit nila sa puso, but what I can tell you is, if it's not getting better, you need to be assessed. Ayun po. Huwag niyo pong pabayaan. Yun lang.
From Miss Cindy Abinas Cantilo, good PM po. Need po ba magpa-ECG if BP is 140/90?
Ma'am, I would say if that is your only problem at wala na pong iba and you are maintained po on medication, first of all, you need to be maintained on medication kung 140/90 ha. The recent guidelines po, 130/80, kung mataas na po yung cholesterol nyo and you have a high cardiac risk, you are already considered hypertensive. So 140/90 is already considered hypertensive, and I would suggest po A, lifestyle changes, and B, kung wala na po talaga i-change sa inyong lifestyle, then maybe a gentle medication would be good. Should you have an EKG if you have high blood pressure? Yes, you should, at least once a year.
From Miss Lincejo, si Zapalnam. Ma'am, ako po may butas na maliit ang puso ko, na 2D echo na po ako. Di po ba delikado yun, ma'am?
Is this an AV is this a closed, hindi po nagsarado sa atrium? You might need to look into that, ma'am, because I don't want to scare anyone, pero meron ho mga consequences po talaga yung unclosed po na what we call po atrial septal defects. Those and VSDs po, they need to be looked at by a cardiologist, ma'am. Okay? That's another whole topic po. In fact, that happened to Kuya Kim, but patingin po kayo, ma'am. Opo. And usually there are ano po there are criterias for what should be done for these kinds of cases po. Okay?
From Mr. Orly Estela Dungkamusni. Okay po,
Opo.
Doktora. Salamat po. Alam ko na po ngayon, good luck sa bukid, Doktora.
It's actually medyo malamig po sa morning. So, sir, don't worry so much. But if it's getting worse, then I would advise po a checkup. You know what? Not everything that you feel is scary. Okay? But if it is continuing po, the best thing to do ay magpatingin. Yan. Malamig po dito sa umaga.
Doktora, that's all for today.
Okay, hopefully that you enjoyed this talk. It's a little different, ano, but I like it. Kasi po, it's common and people undergo ECGs a lot. Yung sharing na lang po showed you that people were interested eh. Opo. So sa inyo po lahat, maybe we should do more cardiac topics because I'm not only a pulmonologist but I'm also an internist. So I do a lot po and read a lot about cardiac issues also. Kasi po, ang pinakamalapit po sa baga ay ang puso. Usually, nag-intermingle po yung dalawang problema niya. So sa inyo po lahat, a very good afternoon and salamat po.